Thank you, David, for giving me the opportunity to respond to this prompt. I believe that in this situation, we're really looking to balance our care for our rural indigenous communities, as well as balancing that with the long-term sustainability of new dentists and dentists as a whole. To approach this question, I'm really going to first talk about my position on both sides, understand the pros and cons of both sides of this policy. Afterwards, I'm going to talk about what I think and what my stance would be on this policy and why, as well as any minor adjustments I may include. Afterwards, I'm going to talk about some of the systemic issues that we experience in these areas, as well as my own personal connection to this area. And lastly, I want to give a small link to my future as a dentist and why this prompt reminds me of the University of Alberta specifically. So, first of all, we need to understand this from both sides. So, from the rural and Alberta side, the rural and indigenous side of things, we have to understand that oftentimes many rural communities, and our indigenous communities especially, are small geographically isolated areas. They often lack access to basic healthcare specialists and even general dentists and general physicians as a whole. And because of this, they often suffer from long-term consequences of issues that were not detected early, such as small cavities that could have grown to massive decay in their teeth, causing for excessive and very invasive procedures. Because of this, it's really important that we understand that our rural areas are really in need of higher quality care, whether it be from physicians, dentists, nurses, or anything as a whole. And because of that, it's important to understand that policy like this is a great first step in acknowledging the problem that is present in these areas. In contrast to this, if we look at this from the perspective of the dentists, many dentists who graduate often graduate with heavy loadings of debt, whether it be from student loans or other things like that. And oftentimes it is normally easier for these kind of dentists to pay off their loans when working in large urban areas and metropolitan areas. And because of that, it can be understood why many dentists would often choose to prefer working in these metropolitan and urban areas. And as a dentist, we have a responsibility to treat our patients. We have a responsibility to give care to our patients, but we cannot be forced to practice in a specific area over the other. That's why I believe that a policy like this is also beneficial for the dentist because a, it allows them to get more experience working in these rural environments. It allows them to give back to these rural communities while also being able to have an extra financial motive. And yes, it is important to acknowledge that this may cause some kind of differential between experienced and new dentists who are choosing to work there. But despite this, I still think this is a great policy to move forward with. I think this is a great policy to move forward with because of some of the previously mentioned areas that I talked about. It allows us to increase the care in our rural areas and communities. It allows dentists to also be able to get experience in these areas, but also be able to have a slight ease in their financial ability. And this is also key because the long-term sustainability of our dentists depends on whether or not they're able to kick off their practice from the starting foot. Imagine if a dentist who recently graduated from dental school goes out and works and experiences severe burnout because of the financial burden that they face upon themselves. And because of this, they actually end up quitting the practice. This would be a huge loss and a huge detriment to the practice as a whole, right? And so, while I do believe that this is a great policy and we should move forward with it, there is one small caveat that I'd like to add and I'd like policymakers to consider moving forward. And that is that after working in these 5 years in these rural and our indigenous communities that they be that if they do leave these areas that they are recommended that they need to follow up with at least 2 years for some of the patients and some of the other doctors that are there through things such as teledentistry and remote consultations. I believe that this is a great addition to these because a it'll allow the patients to continue giving care to these communities even though while they're not physically there through things such as remote consultations with patients and doctors and teledentistry to help support doctors. I believe that this will also help increase the access in these environments because if doctors are able to meet with these patients online, it can oftentimes reduce the burden of the already overwhelmed clinics in these kind of environments. And fundamentally, this prompt really speaks to an institutional issue in Canada, and that is really the cost of healthcare and the cost of dental care as a whole. And it speaks to how as dentists, it's very difficult for us to be able to give care to both people in these rural and indigenous environments due to things like cost and access, but also to people who are already struggling through poverty and things like that. And that policy changes like this, as well as policy changes such as the Canadian Dental, the CBCT, the CD, the CBCT, sorry, CDCP are great additions to this policy. And this prompt also additionally, I feel this prompt additionally because I grew up in the small city of Lloydminster, Alberta, and it was a city of around 30,000 people. And I oftentimes remembered that if I had any kind of dental complications, whether it be I needed to get a root canal or my sister had to get their wisdom teeth pulled out, oftentimes our family had to drive out to Edmonton or Calgary, the nearest metropolitan city area, to be able to get to a dentist in a reasonable amount of time. And prompts like these really help remind me of those kind of remind me of me growing up in those kind of environments. Additionally, this is a prompt that really talks about why my interest in the University of Alberta is so great. I've learned a lot about the University of Alberta's dental program, and additionally had the fact that they have three specific rotational areas that are specific to rural and northern Alberta, such as the McLennan rotation, for example. These rotations are really key as they give our dentists, our new dentists, the experience to work in these environments, first of all. And so, overall, as a future dentist, I really see myself wanting to give back to these communities by working in these rural and geographically isolated areas. And so, overall, by looking at this policy from both sides, from both the sides of the dentist and the sides from the urban communities, the rural community, sorry, we should understand that there is pros and cons. But if we take the pros and try to adjust for some of the cons moving forward, we would be able to apply a great policy that would be able to help both our new dentists, our older dentists, our more experienced dentists, but also the people in our rural and in our indigenous communities who need dental care the most. Thank you very much, and I'd love to answer any follow-up questions.